My friends, good evening. Myself Dr. Sunny Chopra. I am Director of Dr. Chopra Spine Joint Solution India. Today we will discuss about the shoulder. We have seen many cases of shoulder age to age. Initial young age we having impingement syndrome of shoulder and rotator cuff tear, traumatic rotator cuff tear and recurrent dislocation of shoulder. Middle age we are having a rotator cuff tear, frozen shoulder, bicep tendinitis, slap tear, and old age we are having a rotator cuff arthropathy and frozen shoulder, and more towards the bicep tendinitis and complete rotator cuff arthropathy. So we are having so much myth about that shoulder, where we have to go, which doctor is for shoulder, because all orthopedic doctors are not able to cure the shoulder treatment. We are continuing giving the medicines, we continue giving the injection in the shoulders and all that. Many females are come to us which having difficulty in shoulder. She can't sleep over that shoulder, बेलना करने में दिक्कत होता है, करची घुमाने में, कपड़े निचोड़ने में, even unlid the open jar, screwing and unscrewing movement, these all leads to difficulty in daily day-to-day activity and all that. And also we are going to continue physiotherapy, then we apply the injections also. Patient get relief for 6 weeks, 8 weeks. Now the trend gets changed. We are having a good armamentarium, we are having a good approach toward the shoulder. We are having a minimum invasive shoulder approach via shoulder orthoscopy and shoulder rehabilitation protocol. Patients, they are more towards rehabilitation, physiotherapy, even the patient having a rotator cuff tear, even the patient having a so massive tear and he can't able to play sports, like many patients who are having a overthrow activity, basketball player, volleyball player, they having a slap tear. So that scareness of the shoulder pathology has now from onwards is get totally disappear. We having a many patient we dealing with shoulder pathology, like this is a shoulder joint, we having, this is rotator cuff, this is a bicep tendon, this anteriorly is subscapularis, the whole they form the shoulder rotator cuff. So through minimally invasive technique, through shoulder orthoscopy, we repair the rotator cuff using suture anchor, using radiofrequency ablation. We decompress that subacromium area, we capsulotomize the capsule part, we put the patient under shoulder rehabilitation. Through the bicep tenotomy also the patient get relief in old age. If the bicep get tear in young age, we have to do bicep tenodesis also here. And we have seen the many patients who having a recurrent dislocation more than 20 to 30 dislocate a shoulder in a year. So there is a pathology which is known as Bankart lesion, because when the first dislocation in the shoulder, the Bankart get torn up. So we repair the Bankart lesion using a suture anchor and through the shoulder orthoscopy. We discharge the patient next day, 24 hours. There is no any muscle cut, no blood loss, no any complication rate as seen in the shoulder. Early rehabilitation, early physiotherapy, early mobilization of the shoulder joint, that makes more rehabilitation protocol easier as compared to if we are going directly physiotherapy and all that. Mind you, if the patient having a rotator cuff tear and we put a injection or we put a patient on rehabilitation, that creates more tear vastness and we create more increase in the tear as compared to if we do orthoscopical rotator cuff repair, that leads to more sound toward the rehabilitation. Physiotherapy also get more edge after the repair. We acromatize or we acroplasty the acromion process which impedes the rotator cuff. We tenotomy the biceps, which also put a pressure over that cuff area, that rotator interval area, and also in some cases we do the tenodesis also. We do the Bankart also. All the patient we discharge after 24 hours. We put the patient on shoulder rehabilitation up to 4 to 6 weeks. 2 to 3 mm stitch, dissolver stitch we applied that. And mind you, the scariness and the difficulty in shoulder treatment all get resolved from the shoulder arthroscopy. We just, thanks to God Almighty and well-wishers, we are dealing with shoulder arthroscopy, we are dealing with shoulder pathology, we are dealing with shoulder rehabilitation. Our patients initially 4 to 6 weeks after cuff repair, patient having a pain for 2 to 3 weeks, but good shoulder rehabilitation, the patient gets relief from that area. Thanks.